name's Claire Kelly and I'm the Manager of Youth Programs at Mental Health First Aid Australia. GP might see a range of different things. When we're talking about non-suicidal self-injury in young people, girls are more likely to either scratch or cut their skin. And when I say scratch, it could be anything from small, sort of gentle patterns, but which seem to be there a lot of the time, through to quite severe scratching with maybe even with implements, where often we can see infections and things like that because they might be shallow, but lots of nasty stuff is introduced under the skin, and even fingernails. Scratching over and over and over again can cause terrible infections. Also likely to see cutting, which is generally going to be fairly medically superficial, but particularly as time goes by, we might see it get more severe over time. For young men, we're more likely to see hitting. So it might be that they're actually hitting themselves, or that they're hitting a body part against the wall, and that might be punching a wall, or it might be hitting their head against the wall, something like that, or even throwing themselves against a wall. That can be tricky because boys might not recognise exactly what it is that they're doing. If we say, have you ever injured yourself? They're likely to say no. But if we say, have you ever felt so overwhelmed by your emotions that you had to do something to get it out, and maybe you hit a wall, that they can recognise. So it's often about using some of the right language and actually talking about the relationship between the behaviour and the emotions. We also see biting and burning as less common, but they do occur. Now, in terms of what to look for, most injuries are to the arms and legs. However, injuries can occur anywhere, and they can be hidden by a young person engaging in injury on the inside of their thighs, or only on their stomach, or on their breasts or genitals. And that's not something that's likely to come up in most sorts of interactions with a patient. And many young people will go to incredible lengths to avoid revealing their injuries. It's actually one of the reasons why we think that it's important that lots of different sorts of people are able to recognise the signs. So, for example, a young person might front to somewhere like a pharmacy because they've got an injury that they can't keep closed, or that they can't keep clean, or that they're starting to worry about. And they might show that to the pharmacist, who can then say, hey, when this sort of thing's happening, it means you're in need of some help, and it's okay to need help, but let's find the right person. Or a school teacher or a school counsellor. It's actually pretty scary to front up to a GP and say, this is what's going on. That's why we think that referral process is so important. But a GP certainly should not be closed off to asking the question. Should look when you've got any evidence of distress or poor mental health in a young person, it's worth even just asking the question. Sometimes when people are feeling as lousy as you have been lately, they injure themselves. I'm just wondering if that's something that you've been doing. We shouldn't be afraid to ask questions. We just have to find ways that are non-judgmental to do that. And even if there's a little bit of your brain that is judging away madly, just shut it off for now, set that aside, and just be really open to hearing the young person's experience as they describe it and how they're feeling right now. If a GP suspects that a patient has been engaging in non-suicidal self-injury, I think it's really important to approach it in a way that is non-judgmental, is open, but is also direct, because it means that it's showing that the GP is not afraid to talk about self-injury. And look, honestly, a lot of people are, and it can just be so reassuring to be talking to someone who's not afraid to have that conversation, that even just getting started that way can be an incredible help. Just to actually have someone say, hey, I think I know what might be going on here. Are these injuries something you did to yourself? It's like somebody is speaking directly to me rather than whispering or rather than speculating. And it gives the chance to actually talk about maybe just how bad things have been. Non-suicidal self-injury rarely occurs without a mental health problem underneath. When we look at population level study called ANESI, which is the Australian National Epidemiological Study of Self-Injury, one of the questions that they asked was actually about a previous diagnosis of a mental illness. And about 40% of the people who had engaged in self-injury had a diagnosis of depression, and about 40% had a diagnosis of anxiety. So very, very high numbers. However, it could be any illness at all. In fact, we see between a quarter and a third of young women, where we know a little bit more there, with eating disorders will engage in self-injury as well. Certainly, it's very commonly linked in people's heads with borderline personality disorder, although it is far more common than borderline personality disorder, and we shouldn't be quick to make that link. And it's a very, very stigmatised mental illness and very, very tough to live with. But we also see it with psychosis. Certainly where we're seeing patterns of substance abuse, we can be quite concerned, because a young person who might injure themselves in a very medically superficial way whilst sober might do themselves considerably more damage when intoxicated. And higher levels of use and of not just alcohol but a range of different substances is quite common for people with self-injury. And if you think about self-injury as a coping mechanism, which is what it is, it's a maladaptive coping mechanism, it probably makes some sense. Often reflects an inability to self-soothe, to find ways to make yourself feel better. It's always got to be something external, and whether that is drinking too much alcohol or reaching for a razor blade, there's going to be some way to get a cap on that distress. People who are looking for more resources, honestly, the worst news I can tell you is that there's actually nowhere near enough. Almost any website that includes information about mental health will have a fact sheet. It may be about non-suicidal self-injury, or it may be about self-harm more broadly. I can certainly recommend the Mental Health First Aid website has our mental health first aid guidelines, and they're not designed for mental health professionals, but for anyone who doesn't know a lot about mental health, those guidelines can actually help to guide some action. Mental health first aid courses, certainly youth mental health first aid courses always include a component on non-suicidal self-injury, and we have in development a short course which is designed for anyone who feels that they need more knowledge than they would get in that sort of 40 minutes within a 14-hour course.